beautiful people. After delivery, what next? Who takes care of me and who takes care of the baby? Now, this is what we're going to be talking about on this episode of Nursing with Abby. Thank you so much for joining me on this wonderful episode as we talk about postpartum care. After delivery, what next? Before we go into the topic for the day, thank you so much all my subscribers for always supporting this channel. I do not take your support for granted. Thank you so much. Thank you. Now, if you're watching me for the first time, my name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. On this channel, I talk about nursing, I talk about lifestyle, and I talk about everything in between. Now, today, we're going to be talking about, this is a continuation of our antenatal and motherhood series. I think this should be the 19th series. Yay! So, today, we're going to be talking about postpartum care. After delivery, what next? But before we move into that, please, I would like you to do 4 things for me. Please like this video. Please share with your friends if you see that it's it has valuable content for you. And please make sure you subscribe. And also, I love to see your comment in the comment section. Yes, I really love to see your comment in the comment section. Thank you so much. Now, this channel or this video is not only for nursing mothers alone. It will also be advantageous for nurses who want to refresh their memory, student nurses who are preparing for the examinations. We're going to be giving you little tidbits on how to get there and get better. Now, let's move on to postpartum care. Now, I'm just going to use an acronym called Bubble. Yes, Bubble. So it can help us to navigate through easily. Bubble is BUBBLE. Now, the first thing is that's the kind of care that we give to the mother after delivery and then afterwards. Okay. Now, postpartum is actually given 2 different classifications. Now, we have the immediate postpartum, which is immediately after the delivery of the baby to the next 24 hours, and then from that period to the next 6 weeks. Okay? Yes, 6 weeks. 6 weeks after delivery. And that's where we actually have that postpartum period where we expect that the mother and the baby bonds together and better. They get to know each other, and the nutrition, and the mother also rests after delivery. So nutrition of the baby occurs at this six weeks also, and then the mother also has the opportunity to rest after the rigor of labor and delivery. Now, for the breast, so we start with the first B, which is the breast. Now, we expect that the breast will have been properly taken care of during pregnancy, and then at the time of after delivery, that is the period where the baby has to get nutrition from the mother, and that's when breastfeeding starts. As much as possible, we try to involve the baby, include the baby early, putting the baby to breast at least at 30 minutes after delivery if there is no other contraindications. So what do? The mother definitely would still be trying to struggle with the rigors of labor, but it's a very good way of trying to ensure that our uterus is contracted and the bleeding is being stopped or arrested if there is any. So because there is a letdown, there's a mechanism that happens when the baby suckles on the breast. It releases what we call oxytocin, which is an hormone that helps to contract the uterus. It helps to let down more milk, and then it helps to control bleeding for the mother. Okay, so it's doing both functions. So while the baby puts his mouth or her mouth to breast, trying to ensure that the baby puts the mouth not only on the nipple but on the areola. I've talked about this during the breastfeeding video I did. You can check the link in the description box below or in the comment section. So while the baby is putting the mouth on that areola, not on the nipple, the baby is trying to let down more milk, and then the baby will be satisfied well. So your breast has to be number one, the nipple has to be pointed or protruded or prominent, if you call it like that. So it will help the baby to be able to grasp on the areola, not the nipple. Now, another thing is your uterus. Now, your uterus is what housed the baby for 9 months. Now, it was already an expanded balloon for 9 months. Now, by the time that the baby is out, we expect that it would come back to a near pregnancy state. But it definitely might not come back completely, but it has to come back to near pre-pregnancy state. So instead of being an abdominal organ, it will now come back to be a pelvic organ. Now, immediately after delivery, we expect that the uterus has to be at the level of the umbilicus, and then we keep start going down, 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 down till it's not visible at the abdomen anymore. Okay, so we expect that the uterus, contract. Now, as the uterus is contracting even after delivery, you still feel pain, most especially when your baby is breastfeeding. Yes, that's what I explained about the mechanism of oxytocin. Now, another thing is your bowel. Now, for the period that you were in labor, you probably could have emptied your bowel during labor. A lot of women, they would always have to empty their bowel before the baby comes out. So probably your bowel, especially the lower part of your GIT or the gastrointestinal system, will have been empty. So it will require for you to start eating. So probably within the first 2 days, you might not even have to, you might not be able to go to the toilet because your bowels were already empty during labor. But we expect that by the third day, as you've started eating from the time of delivery, maybe something liquid, semi-solids and all that, we expect that your bowel movement starts within the next 2 to 3 days. So if it doesn't start within 5 days, please make sure you visit your doctor. Another thing is your bowel, your blood. Sorry, your bladder. I beg your pardon. Your bladder. Now, your bladder is what houses your urine. Okay, so definitely at the lower stage of the later stages of pregnancy, you would have the urge to always go to urinate. Yes, that is because the uterus, that's where your baby is housed, and then your bladder, they're so close together. So as your baby was descending trying to find its way out, your bladder definitely has to be emptied to allow such activity to go on. So after delivery, we expect that because your body has been filled with fluid to support the growth of the baby, now your body is being sensitized to know that the baby is out, and what you need to do is to empty all those fluid in form of urine. So you're going to be having a lot of urine production at the postnatal period. Yes, you might have to, you won't feel so, you'll be wondering what's happening. Yes, because all those fluid that have been filled in your body to help your baby and yourself go through pregnancy has to come out. So it will come out in form of urine, which is very good. But that still does not rule out the fact that you still need to take a lot of water because you're still going to breastfeed. Okay? Now, another thing is your lochia. Now, lochia just means that the blood that comes out after delivery. Now, a lot of people will be wondering what lochia is much. How do we quantify a large quantity of lochia? Now, immediately after delivery, you still have your pants or pad being soaked with blood. But we expect that if at any point within 15 minutes you notice that your pad is saturated. Saturated means that like it's dripping blood, then there is a problem. Probably there's a retained product inside, or you still need to some clots still need to be removed, and then your midwife can help you by urinating, helping you to urinate, and then trying to rub your uterus for form contraction. They could even give you some oxytocin drugs to help you to contract your uterus. So 15 minutes is the time. If within 15 minutes the pad you use, maybe one or two, is completely soaked, then you need to call the attention of your healthcare provider. Okay, and we expect that within the first 2 to 3 days, it's going to be, at least you're going to be having like changing of pads like 3 times in a day, which is normal. But by the time it gets to like by the 4th day towards the 10th day, we expect that even the lochia, that's the blood, will start to change color from being red. It will start to turn pink. Okay, it will start to turn pink, and then by the 10th day to the 14th day, that's we have the rubra, which is the red one, the serosa, which is the pink one, and then the alba, which is the final one, which is almost be like a menstruation that is getting to the last day or thereabouts, and then till it fades away. So that's how it should be within the first 2 weeks. That's not to say that some women, might still see some traces of blood till the 6th week. There is no problem, but it's sure not going to be so much or larger quantity. Okay, and the last one is exercise. Now, it is important for a woman who delivered to, try and exercise her muscles. Now, there are a lot of people who, after delivery, they're going to go through a lot of pain from the stress of labor. At this point, the exercise can even mean having to relax, having to rest. Okay, so at this point, excuse me, you need all the help you can get. to help with the baby, to help with you, household chores, and then so that your body can relax. That's a way of relaxation. That's a way of exercise. You can also walk around. That is exercise. But not at this moment that you have to give yourself so much stress. Okay? Because you've gone through a lot of stress during labor. So at this point, you really need to rest and do some exercises, like I said, like walking around, like just relaxing, stretching your legs and all that. Now, if at any point at the postpartum period you notice excessive bleeding, like I said, within 15 minutes your pad is completely soaked, there is a problem. If you notice that your tummy is getting bigger, that your uterus is getting bigger than normal, there is another problem. If you notice that you're not going to the toilet, maybe for to urinate or to pass out stool or feces within 1 week, there is an issue. In fact, for the bladder, if you notice within the second or third day you are not urinating, there is a problem. If you also notice that the local that is coming out is much or is smelly, or the color is completely black with full of clots, there is a problem. And if you notice that you're having issues having to walk around or move your muscles, please make sure you report to the healthcare provider. All these are danger signs that needs to be treated. If you also notice that you're having headaches that are constant at the frontal part, please make sure you go to the hospital. Some people might have like flashes, okay, and some people might have frontal headaches, like I said, or some people might just be so weary and weak and tired, excessively tired. Please make sure you visit the hospital. Thank you so much for another episode of Nursing with Abby. Be able to share or talk about this postpartum care. If you have any questions, any queries, any collaborations, sponsorship and adverse placement, why not? I'll be glad to have a word with you. I'll scroll my email on the screen so you can contact me, and I'll as much as possible try to answer all of your questions. Thank you so much for another episode of Nursing with Abby. Till I see you in my next episode, it's bye for now.